Case 5 of ketamine. Alright. Got a patient who was initially seen in urgent care for a painful perianal abscess. He's had this before, even having fistulas, so there was a concern whether it was deeper. CAT scan of the lower pelvis was done with IV contrast, and it was just localized externally. Now this patient got no relief with Toradol, with Percocet, even IM morphine, refused to be seen by a nurse practitioner or a PA, so became my patient. So we try to negotiate with the patient that we will need to give him some local lidocaine because it's very superficial, and patient threatens to kick our asses. He's 6'5" or over 250 pounds. This is what he tells us. Long patient, long and tall, feet hanging over the edge of the bed. Here with his wife, who refuses to leave to make sure we don't hurt him. Advise her not to be in the room while he yells, because some of the stuff he won't remember with the medicines we give. And of course, he only wants IV medications and to be completely knocked out. I didn't want to call anesthesia. He's a young guy. There was no medical problems, I think. Alright, so again, ASA score was like 1. He may have had one medical problem, maybe hypertension or asthma, but it wasn't an active issue then. His BP was slightly elevated, like 150s, 160s over palp and systolic. Heart rate was normal. He was afebrile, not toxic appearing. Alright, so we decided to give him propofol. He needed high aliquots of this medicine, and guess what? He would fall asleep, we would touch the abscess with a little bit of a needle with lidocaine, fully wake up and threaten to kick our asses again and again. Alright, so after 2 or 3 aliquots of propofol, got ketamine. He got nystagmus, fell asleep, and to my surprise, he must have had some ongoing emergent phenomenon because he started to howl. Every time we touched him, even when we didn't touch him, howling. Woo! Very loud. The wife was freaking out a little bit. We had to calm her down and say, hey, I don't think he knows what's going on. Kept howling. So now, how do you stop the howling? Now, ketamine does have 5% chance of causing emesis, associated emesis. So, propofol was already in the room. We gave him aliquots of propofol, and it worked. The howling stopped. Thank God. It was a little unnerving. We were able to put the lidocaine injection, pierce, and more than 5 to 10 seeds of purulent nastiness came out of that anal abscess, perianal abscess. We were able to pack it and recommend him to go to our colorectal surgeon. He had also been recommended to see another colorectal surgeon after he had a falling out with his initial colorectal surgeon at another institution. So I did tell the wife to warn him in the future what would happen if he gets ketamine. He will howl, and propofol by itself is usually, for him, most likely not going to be enough. The patient himself had been worried that his experience would be like a Michael Jackson experience of death. I told him, we know what we're doing, and our job is to prevent that type of death from happening. All right. So I told the wife to remember what happens with ketamine with him. It does work, but it needs to be used with propofol. Propofol by itself would not work on this patient. No hypoxia until CO2 was placed on this patient. There was no apneic spells. And after the whole ordeal, he wakes up a little bit and says, when are we starting? Does not remember that we even did this. Asked him about his dream. Did not remember the dream. All I know, I think of him as the Howler. I share my experiences so other people do not repeat my mistakes, and I welcome you to future episodes of School of Airway to learn more from my experience. Thank you.